Dr. Sangeeta, good afternoon. Pleasure.
Sangeeta ji, good afternoon.
Good afternoon to everybody.
Good afternoon, ma'am.
Good afternoon. So, I think we can start the session.
Yes, ma'am, we can start. Good afternoon, ma'am. We can start.
Yes. So, on behalf of Department of Commerce, Ministry of Commerce and Industry, I would like to welcome all the participants and the panelists for today's session on the quality and productivity aspects of medical value travel. So, as we know, this is one of the sectors which has emerged as sectors for our export earnings, and it is a sector, it is an area which many ministries, including Ministry of Health, Ministry of Tourism. So it is a coordinated efforts by various departments and ministries of Government of India, and of course Ministry of Ayush as well, because of the wellness component. So you would be aware of the Champion Services Sector initiative, which the Department of Commerce has undertaken. The idea was to diversify our export basket in services. Till now, we have had a dominant share of IT industries. So the idea was to diversify into other services. And one of the 12 sectors which were identified was the medical value travel segment. And we have been working along with the Ministry of Health and Family Welfare and with the industry chambers like FICCI and also the council, that is the Services Export Promotion Council, and with the Ministry of Ayush and Ministry of Tourism to take forward this sector and, to identify which are the pain points for the industry, for our service suppliers, both domestic as within with the other countries, and take up these issues and try to resolve that. In the Champion Services sector, one of the cross-cutting reforms that was envisaged across all the 12 sectors was the standardization, the process of standardization and the quality aspect. And this is something which has been talked about in this particular series of webinars. And I'm very happy that we have a very distinguished set of panelists here across different verticals of the medical value travel segment, and to deliberate here on the quality and the productivity related issues. We also have Dr. Manoj Nesari. Sir is the advisor to the Ministry of Ayush, and as we know that Ayush and the wellness segment is very, very important for our medical value travel segment. So, as all of you know, that we are looking forward to the set of recommendations that we can put together, and that can be our basis for doing further work in this area. And we would like to also mention that given the importance of services sector and the importance of quality in services sector, the Bureau of Indian Standards has set up a service sectional divisional committee, which is the highest committee only for services. And under that, there are 14 sectional committees, and one of them is on medical value travel. So they have also come out with certain standards, and they also propose, it's a work in progress. So they have a body of work that they are doing. And the need is that we converge the efforts of various actors in this quality and productivity sphere. So we have the PCI, and we have the ministries and the line departments, and we have the consultants. So the idea is that we converge our efforts to take it forward and, to put India on the quality map as far as the medical value travel segment is concerned. So thank you so much. That's just a brief introduction of various things. I'm very keen to listen to what the various panelists have to say, so that, we have our work ready for we have a roadmap ready for the future. Thank you so much.
Thank you so much, ma'am. You've already set the context and set the ball rolling, but there are thousands who are joining this series of Udyog Manthan. And it'll just to introduce them to the concept of Udyog Manthan, please allow me to submit that Udyog Manthan is an initiative by DPIIT under Ministry of Commerce and Industry, Government of India, in association with Quality Council of India and National Productivity Council and all the industry chambers. It is a marathon of focused sector-specific series of webinars for promoting quality and productivity, as you've already mentioned. So today's webinar is also is 18th in the series, and it's part of the Udyog Manthan initiative. And My name is Dr. Atul Mohan Kochar. I'm the CEO of NABH. I'll be moderating this session. My co-moderator will be Parveen Kumar Mittalji, a Senior Director with FICCI Healthcare Services. And Madam has already mentioned and welcomed all the distinguished panelists who we will introduce as we proceed. And nothing will be complete if we do not introduce Madam also properly. So please allow me to read out a very, very brief profile. Mrs. Sangeeta Saxena is an officer of the Indian Economic Services of 2001 batch and currently posted as Director in the Department of Commerce, Government of India. In her present assignment, she specializes in services trade issues and is a services trade negotiator for India. She has handled work relating to WTO and India services trade negotiations and dialogues with countries like USA, Australia, New Zealand, all the ASEAN countries, Singapore, Malaysia, Latin America, Sri Lanka. She has also handled plurilateral negotiations like the Regional Comprehensive Economic Partnership Agreement, G20, BRICS, and Shanghai Cooperation Organization. She is also deeply involved in the work related to 12 identified champions services sector under the Champion Services Sector scheme. So thank you so much, ma'am. And beyond this, you have already, she is coordinating the entire effort on part of the ministry for the entire series. So this is a 45-day Manthan, and we genuinely hope that after the final compendium gets prepared, some really good churning, out of this churning, some good positive vibes come out and actionable points get taken home. So welcome once again, ma'am. And over to you, Praveen ji. And we'll be assisted by Aparna Sharma ji. She's the Assistant Director with FICCI as a rapporteur, and she is helping in compiling all the take-home points from today's learning. So, Praveen ji, you're there? Yes.
Thank you, Dr. Kochar. It is indeed an honor to be co-moderating with you this entire session. FICCI has been deeply involved with the medical value travel sector, and we've been working with Department of Commerce on this, promoting the healthcare services globally. With this, I also wanted to thank Madam for setting the context and updating all our colleagues from the industry who have joined us this afternoon. May I now request Dr. Nesri, who is the advisor for Ayurveda. He basically is responsible for international cooperation and also advises the ministry on Ayurveda at the Ministry of Ayush, Government of India. So Dr. Nesri, we would definitely like to hear from you as to what are your thoughts for the medical value travel and the quality. So basically what we're looking at is the quality aspect from your side as to how quality is so very important and brings in the productivity element as well, while promoting the medical value travel services globally. Over to you, Dr. Nesri.
Thank you, Praveenji, and good afternoon to all of you. I see here Mr. Arvind Vattasvi, Sangeeta Saxena, Professor Mishra, Professor Upasana Arora, and many others. So I'm happy that all of these dignitaries and the established panel it is here, and I'm also congratulating to Mr. Dr. Atul Kochar for taking this initiative and organizing this Udyog Manthan, and especially this medical value tourism. When usually we talk about the medical value tourism, we usually talk about, or we usually think about the either knee replacement or cardiac bypass. But if you see the figures, the Ayush sector is also rising very fast, and the Ayush-based medical tourism, especially the Ayurveda-based medical tourism, so it is catching up very fast. If we actually look at the figure and the data which is there with the DGFT, almost 30,000 crore is the turnover of the Ayush, and there is huge market which is actually increasing in the leaps and bounds. And especially in this last 1 year almost, because this pandemic started in the month of February, and from there onwards, there is huge demand for the Ayurveda, especially for the COVID and for the immunomodulators, immune boosting medicines. So this COVID has actually given a major leverage to Ayurveda and Yoga and the Ayush systems. And because of that, the demand for this system, they have increased at a domestic level as well as at the international level. And actually, there is a lot of scope to further capitalize that. Now, since the last 1 year, this international travels, they were almost banned. The domestic travels, they were also restricted. So the indoor facilities for the medical value, they were significantly affected in all the hospitals across the country in each sector, whether they are the Ayurveda, whether they are Siddha and other things. But now, since it is the sector is opening, but now there could be some hitches into it. So some of the hitches is basically getting the visa, because getting visa is a major problem, and the ministry is taking up this problem with the Ministry of External Affairs and the Ministry of Home Affairs. And we are requesting that to allow the people, those who want to come to India to take the Ayurveda treatment or Siddha treatment or yoga for their well-being, as well as because when we talk about the medical tourism in Ayush sector, it is one well-being is one part. At the same time, the treatment is another part. And especially in COVID, there is a lot of scope in treating the post-COVID complications. The post-COVID complications, there could be fibrosis, there could be breathlessness, there could be some other issues, and a lot of clinical trials, 114 clinical trials the ministry has conducted, and we have sure a lot of evidence into it to demonstrate that how the Ayurvedic medicines, they are very effective. So from the journey has actually now started from wellness to the curative aspect, and this is the large the forum is available. This the entire the scope of the services, whether they are related to the regenerative services, whether they are related to the infectious diseases, whether they are because of the autoimmune disorders, whether they are rehabilitation kind of conditions, post-stroke conditions. So many such kind of patients, they do come, and in the last few years, the ministry has also established the collaborations with more than 25 countries in the world at the country-to-country level MOU. At the same time, the MOU at the academic level, it is with almost 30 institutes. The academic collaboration is there. And beyond that, the ministry is also engaged through the Department of Commerce and the Ministry of External Affairs in bilateral negotiations, as well as in the multilateral forum, whether it is SCO, whether it is Mekong Ganga Cooperation, whether it is the G20, and all these countries, they are gradually opening up. So while actually we are talking about the opportunities, I would suggest that the industries, they should first target the various countries where the Ayurveda or the Ayush system, they are formally recognized. And there are many countries where Ayurveda is recognized. They are in the Middle East, they are in the African countries, they are in the ASEAN countries. Now the latest entrant, they are the Latin America. Latin America is coming in a large way, and they are recognizing Ayurveda as the system of medicine. So this field is opening up very large. So it is not just based to Europe and USA, but it is now expanding significantly. And we should actually focus to promote the medical tourism based on Ayush in all these countries as well. But while doing so, there could be some problems, and especially the problems related to the quality of services. And this quality is very important. As you know that the ministry is working with the QCI and NABH, and this NABH standards, they have already been established, they have been developed, and now many more hospitals of Ayurveda and Unani and Siddha, they are coming forward to get the accreditation. The ministry recently launched the Champion Sector Services Medical Value Tourism, and in that medical value tourism, the ministry will be supporting the private sector to establish Ayush hospitals in the greenfield. But it is mandatory for all these hospitals to become NABH accredited hospital within 1 year of the establishment. So ministry has given a lot of thrust to the accreditation and the quality standards of the infrastructure as well as of the services. At the same time, there are almost 700 hospitals which are attached to the teaching institutions, and for that also the ministry has issued the guidelines through the regulatory authority that all these hospitals, they should be accredited hospitals. so that the quality of the services they can be ensured. The third part, which is very important, is that the supporting staff, that is the paramedical sector in Ayush, so that is not yet regulated, and it is a major hurdle. I would like to recommend to this particular group that the government should take up this activity to regulate this staff. The ministry had taken this initiative, but it is yet to see the light of the day. Whether they are the massage therapists, whether they are the Panchakarma technician, whether they are the Ayurvedic nutritionist or the diet therapist, whether they are the Prakriti analyst. So there is, whether they are the Marma therapist. So there is a huge, this area is still remain to be tapped, and it needs to be properly regulated. It needs to be properly nurtured so that we can have the good therapist. When a doctor sitting in a hospital prescribes some treatment, so ultimately, it is the therapist who is actually going to give the therapy to the patient in the rehabilitation or in joint pain or something. So the therapists, they are very important, and this part is not yet neglected. It is neglected, it is not yet addressed properly. The insurance sector is another problem. The insurance sector, especially the insurance portability, when the people they are coming from the foreign countries. So this is another area which needs to be addressed, and now many more insurance companies they are coming forward, and they are offering the packages for the Ayurveda and yoga and other treatments also. But then it is yet to be still on a large scale. It should be affordable to the people. It should be it should actually include many more diseases, so that the people they should get attracted to it. And as I mentioned, that it should be compatible with the foreign agencies also, so that those foreigners who are coming over here, so they can also get this insurance services. And the quality of medicines, which is the another area which also needs to be addressed. The ministry has taken many initiatives, and now we are in the process of even establishing the ISO standards at the international level. The Pharmacopoeia Commission is already working. There are some regulatory hurdles; they are still there. It may require, rather, it would require some changes in the regulations, whether changes in the Drugs and Cosmetic Act, whether the changes in the other acts which are at the central level, and the ministry is taking those issues with the relevant departments and the relevant ministries. The third thing is the Department of Commerce, when they are engaged into the international dialogue on the trade and services. So a few years back, the Ayush was not a strong part into it, but nowadays Ayush is also included, and we appreciate the initiative taken by the Ministry of Commerce. And with the support of Ministry of Commerce, it would be possible to further promote the export of services at the international level, and further leverage the medical value tourism. So thank you very much for organizing this webinar and organizing the discussion, and the recommendation which will come out of this. I am very much sure that they will be useful in developing the further policies and strategies. Thank you very much.
Thank you so much, sir, for this wonderful context and outlining the entire spectrum of the operations. The industry, you've taken us through the insurance, you've taken us through the services, and in the past few years, we have seen there's so much rationalization to the traditional wisdom, so that we are now validated or attempting to validate all our traditional knowledge at an international platform also. Thank you also for highlighting the importance of quality accreditation and the role of NABH. I think it's a wonderful gesture on the Ministry of Ayush to place the right emphasis on the NABH accreditation at all levels, starting from these new private public people partnership supported hospitals also. Thank you so much once again. Coming now to our speakers, sir, please allow me to introduce one man who needs no introduction, who's devoted a lifetime of efforts into championing the cause of consumerism, consumer safety, for patient safety. He wears many hats. He has won lots of awards. Professor Bijon Kumar Mishra, sir. He's an international consumer policy expert. He's an honorary professor at National Law University, Odisha. He's a winner of so many awards. He's on so many boards, including Quality Council of India, NABET, NABH, Expert Committee. He's 5+ in Accreditation of India Foundation, which he is a founder director. So welcome to you, sir. Please, your comments, your ideas, and please leave us with at least 2 recommendations outlining the quality and the productivity.
Thank you very much, Dr. Ratul. It's you're very kind. You've given such a introduction that it's very kind of you. First, let me thank Government of India, DPIIT especially, and led by none other but Sangeeta Saxena ji. Sangeeta ji, you have done an excellent kind of an opening, and I think what matters is how you set the context, and you have done that in a great manner. I want to thank Dr. Manoj Nesari ji. Dr. Saab has very aptly, kind of laid a pathway or a roadmap to what we should move. I have friends like Arvind here, Naveen from FICCI, Praveen Bhai from FICCI, and Upasana ji, who is hands-on in terms of serving the patients by managing a hospital. So we sit and we share the board in NABH, and my other friends, Dilip Chopra ji and others who are listening today and participating in this Manthan. Manthan always brings out something good, and I'm sure it will bring out something good, and we will all be able to gain out of it. The country, the citizens, the global citizens, everybody will gain out of it. You see, when you ask a consumer, what are your topmost expectations from the service provider? The first thing the consumer says is standard. You see, everybody, whoever pays, either it's out of pocket or taxpayers' money used for the people who need to be subsidized and supported, it has to be based on a standard which will give that kind of a value for money. And this is what we look at. When we are talking about medical tourism, value, creating a value in terms of our healthcare. You see, we have got some of the world-renowned medical practitioners in the country, cutting across all sciences, whether it is, in cardiology, whether it is, pediatrics. You go to any, including Ayush. We have the world's best talents in the country. And the world knows about it. It's not that they're hidden. These talents are well known. They publish their papers in renowned journals where all the known people, read it, and it is created out of an evidence. It is just not sensationalism. It is created out of an evidence. And that evidence brings in the trust and the faith in terms of the service which India provides globally. I must tell you that we are known whenever we go overseas, and I've been very fortunate to sit on country delegations and sitting on negotiations in international arena where we negotiate on behalf of the country and the citizens in terms of harmonizing standards, whether it's within WHO, whether it is within the Codex Alimentarius Commission. In all these areas, when we sit down to negotiate, we keep our Indian constitution or a country's constitution as the super guiding power to take us forward. And all the world countries knows how India intervenes in bringing out a harmonization in the best practices of the world and making it mandatory sometimes in our country. Sometimes the industry takes it on a voluntary initiative to start the mandatory process. So I would first recommend that we in India should be able to set standards, whether it's BIS, whether it is NABH, JCI, or any of the global standards, ISO. But we must have standards so that when anybody comes to seek service from India, they know what to expect and they know what to do. And these kind of negotiations brings in togetherness, and we should sign MOUs. You know, I represent India as a member in the International Alliance of Patients Organization. And you will be very happy to know when I attend those global conferences, they know more than me in terms of the healthcare facilities in India. And they rattle off, you know, where they went to seek. Desiree said, Ayush is becoming so popular, so popular. The only challenge is we need to bring in a good, robust standard. And the standard stems out of, you know, good quality of service, good redressal mechanism, good feedback mechanism. We have to bring in those. So the first, my recommendation is the government of India, along with QCI, FICCI, and other bodies, should immediately sign an MOU with the International Alliance of Patients Organization. See, we have got more than 100 countries as members. And as you know, 190 odd countries sit within the WHO. And these standards are being formalized within WHO. So we must ensure that we are proactive. We are not seen invisible. We have to be very, very visible in the forefront, negotiating for our country, to be showcased. We are already known as the pharmacy of the world. And you all have seen, you know, the kind of, you know, contribution India has done during the pandemic. It's enormous. You know, we, in fact, is termed as the, not only pharmacy, but also the vaccine. We produce the highest in the world today. And the whole world is looking at it. And you've seen the way our Prime Minister has gone about, you know, at the cost of the citizens of the country, has gone about to think about the global citizen and come out, you know, willingly to help the neighboring countries, the small countries, and also the big economically strong countries, to help them at this time of need. So India is never wanting. So we must get connected in a manner that we can build that trust. And we are proud to tell everybody that we do not compromise on quality and safety. In fact, WHO has come on record saying that our CDSCO, which is the regulator for drugs, for medicines, is one of the best in the world. We don't compromise. And we are so proud to tell you, there can be a lot of propaganda against India in terms of quality, but we have got evidences. We have conducted one of the world's largest study ever done, 47,000 samples getting collected from vulnerable points and getting tested in accredited laboratories. And India has been found that we don't even have 0.04% spurious medicines in the supply chain. We don't even have, we have less than 4% in terms of, not for quality standard. But of course, we have to keep improving. We have to be the best in the world. Having said this, you see, I would like to sort of focus also today that the government must bring out policies by using technology. Technology has become the biggest enabler. It brings in transparency, it brings in accountability, it brings in a robust tracing and tracking mechanism. We must have a registry of all the good qualified experts in the healthcare, where anybody in any corner of the world can come to know that if I come to India, whom to meet, where to meet, how to meet, and make it seamless. Ensure that we do not create any barriers for our foreigners, for our overseas people who come to India for healthcare. Right from the time they leave their country or from the time they apply for the visa till they get their care and then they go back home. We have to be with them. We have to make them feel that we are with them all the time because it's healthcare. And because it's healthcare, we do not compromise on quality and safety. That's what the patients want. That care, that people are listening to them. So friends, what I would like to say is that we need to bring in strong policies to make our services seamless, to make our services global best standards. And for that, industry has to play a role. Industry has to bring in terms of a voluntary standard, even if it is not mandatory, to ensure that you look at yourself and you self-retrospect. That will you be able to take that quality standard for yourself or not? And then move on. We have got extremely good laws in our country to protect the patients. So tell that to the world that we have laws that allow people to get away compromising on our health and safety. So it's a huge opportunity, let me tell you, friends. It's a great thing which the government of India is doing through this Manthan. And I'm sure, and I'm quite confident that people like us who are bringing in technology on the National Consumer Day on 24th of December, we launched a portal called hamaraayush.org. Go and visit that portal. Register yourself. Make others register. Tell us what you want. We will tell you. Because we have people working 24/7. You see, we don't sleep because the point is we want to make sure that smile comes on the face of the patient. And we practice it in India and we project it globally. And I was very happy to tell you that my friends who lead patients organization in Europe were present during that launch on the 24th of December. And they were the ones who launched it with their hands. We got it launched. Now it is for the government to encourage us. It is for the government and the industry to encourage us to sustain it. And how we can sustain it, we need ideas from people like you all. Thank you very much for giving me this opportunity. I feel very proud to talk about India and talk about our strengths to the world. And all the listeners who have participated today, I like to thank them personally for taking time to come and listen to this Manthan, because this Manthan will get us to the right place where we need to go. So Jai Hind and God bless all of you. Thank you very much for giving me this opportunity.
Thank you, Professor Mishra. Right from the heart is what we could make out, and very important point about standardization, and that we must have, the quality practices, and standardization is truly required because that would actually have the world look at us in terms of quality healthcare services. Thank you once again, and for your recommendations too. With this, may I now invite our next panelist, who actually, after serving Navy for almost about 30 years, found his calling with the healthcare sector, Commander Navneet Bali. He's the Director for Northern Region at the Narayana Health. Over to you, Navneet ji, and we would all look forward to hearing from you now.
Thank you so much, Sangeeta Saxena ji, Director, Department of Commerce, Government of India. My dear friends, Atul, Kochar ji, learned moderators, Praveen Mittal ji, and a lot of people who I keep interacting on a daily basis. Thank you very much, and all the listeners who are here today listening to this. I think a very, very important and absolutely fantastic discussion today on a very important subject, which has somehow been under the carpet for a very, very long time. And I think it's a great opportunity that it has been brought out to share ideas. And what I liked the most was that from this discussion today, some of the suggestions will be taken forward, and we see that it will bring in a lot of semblance of betterment in the future. So I was talking to my fellow panelists just before we started this discussion that I was meeting the ambassador of Kyrgyz Republic today in my hospital just about a few minutes back. And, we were discussing with him, all the nuances of what he felt. And it was great to hear from him that, India is seen as the forerunner now in everything to do with healthcare. And somehow COVID-19 and thereafter our reactions to the entire pandemic, the way as sort of symbiotic, reaction to where public, the government and the private sector came together to fight a pandemic was absolutely wonderful. Along with this, our vaccination program, and which is being now seen across the world to help the world to get over this, was wonderful. So, he shared a lot of thoughts with me. I also had a lot of my own thoughts, which I thought I will share with the learned panel here. So I will call my small address today as what do we do to bring out, as we have ease of doing business, let us call it EOGT, ease of getting treated. And I think that should be a mantra of how we make it much, much more simpler for patients and their attendants who come to our country to get treatment. So let us say, what do we have already? We already have in our country one of the most extraordinarily good clinical talent, across the world. In fact, not only in India, our doctors are known across the world. In fact, many of our doctors in NHS were in the forefront when pandemic was being fought. So we have that extraordinarily clinical talent. We have the costs, which are one of the lowest in the world for the quality of treatment which is given, and we've got, I think, the best technology. Whether we talk about the linear accelerators to we talk about proton machines and neuro navigation sets and etc. We have that. Our outcomes are one of the best across the world, and also cost of living across. When you compare, because a patient does not travel alone, he also comes with attendants. Even that is a big factor when people come here. So that is also there. So we have a perfect set of ecosystem to sort of leapfrog into the future if we are able to do certain things in a proper manner, because what pandemic has shown us that we can be the front leaders as far as healthcare is concerned in many aspects. So here are my aspirational kind of thoughts, which I think I'll be very happy if these are sort of noted down and we evolve over a period of next a few months and years and put it in place to bring in better this one. So one of the most important suggestion would be to create a single digital platform. It could be a website, it could be an app, or it could be whatever, where it is very easy for patients across, and this could be in different languages. I'm talking from a pure operational point of view because that is what I do, which could be in different languages, which eases registration of patients on this portal. This could be linked with the embassies in our country, and also back home, there could be a single point where they could be linked. There were around 5 or 6 children who came from Kyrgyzstan, were treated for blood disorders, and the ambassador was totally unaware of it because, it is such a disjointed and an absolutely open this one that he was also not aware that, there are a lot of patients who are coming for a specific treatment for Kyrgyzstan and why they are coming. So this digital platform, I think, will be a great initiative, which will bring in that kind of a, sort of sort out and put things in correct perspective where all the stakeholders are concerned. One of the most important, aspects of becoming the front runners as far as the medical value travel and getting patients from abroad would be trust factor. And how do you build trust? You build trust when you have transparency. So along with a single digital platform which eases out things in a very big manner, I think it will be very, very important for us to be very transparent about displaying the cost of treatments, displaying our different hospitals, displaying the various clinicians, etc. on a single portal, which again should be, could be in different languages where people could see, people could choose, and people could actually go over this site, and they could be very, very clear that what are the, we have found many patients when they land up, and some of them come from, poor countries, some of them come from localities where, they try to sell a lot of things like, we have seen patients coming from deep inside Afghanistan, etc. And once they land up here, they then are subjected to many times, financial hardships, which can be taken care of. One very important factor we also found was a post, treatment follow-up. Many of the patients, when they came to our country, got treated and went back, and they completely, the link was completely broken with the hospital and the doctors because, that it was a. So I think this was one more important thing where a post-treatment follow-up could be done, through this website, etc., and where the patients and the attendants could be found to be very, very. And these are some of the best practices which we found in many of the countries. Some of the hospitals already doing it. And the last point was many of the patients who come to our country, also come through many interpreters, many facilitators. And I would certainly see a regulatory mechanism, although they say that regulation is, exactly the opposite of innovation, but some kind of semblance where these interpreters have a value in the entire system, but as some kind of a regulation where their licensing, or maybe just about registering on our portals and being known that these are people who are trustworthy, who do not then mar the name of Indian healthcare abroad. In the end, I also head the board of a artificial intelligence machine learning startup. I think AI, ML, and these startups and these platforms have got a huge value where you want to aggregate and you want to bring in huge amount of quality into whatever you're doing in medical value travel. I think inviting many of these smaller startups, some of the companies, to build solutions where digital, solutions where it brings in much more ease of patients getting treated in our country could be another way forward. So overall, I have just enumerated some of those issues which I found the patients and attendants faced. I have tried to also give some solutions. I'm sure these are just tips of iceberg. I'm sure there are many more learned people who will get into a little bit more granularly over it. But overall, if you look at it, the answer would be that technology, as Professor Bijon Mishra was earlier mentioning, also that technology is going to be a great catalyst in the entire journey that we are going to go forward. I believe that the future belongs to India as far as MVT is concerned. Future belongs to India also because we have got the onus on us now, and we sort of believe that the initiative is now with our country to move forward and to sort of take away those little bit of kinks, etc., which make us sort of not go towards the pole position at all. Thank you very much, everyone, for inviting me here today to share my thoughts. It was an absolute wonderful experience, and I'll wait to hear from all the learned speakers who come after me. Thank you so much, Praveenji, Atulji, and Sangeeta Saxena ma'am for inviting me. Thank you very much.
Thank you, Commander Bali, for these wonderful, astute observations and recommendations. I think the combination which you've said, the low cost, high talent, and empathy-based system, which we already have, will go a long way in making India first and at the top. So these are wonderful recommendations, and the telemedicine, the triage, and these are very implementable, actionable points, which can be seen as a fruit of the pandemic, a positive fruit, which are very, very important, and I'm sure can be implemented upon in an urgency. Coming now, thank you so much, Commander Mali, but coming now to the lady of quality, Miss Madam Upasana Arora, Madam. Not only is she a director of Yashoda Hospital and Research Center, she's a grassroots worker. She has many first to her credit. She's the first Indian lady to be awarded the Fellowship of International Society for Quality Assurance, ISQA. All of us are a member of that. And she has pursued Harvard Medical School Quality Leadership Program. She's been a mission member in CII Healthcare Mission on Lean and Six Sigma. She's a whole lot of credentials to her name, privileges. She's recognized at multiple forums for her contribution in the field of ethical healthcare, and her mission in life is to see an ethical and cost-effective manner and emphasis on maximum international exposure for our Indian healthcare facility. Madam, you are a true ambassador of NABH. At every platform, you have been promoting standards and accreditation. Over to you and your perspective of medical value travel.
Good afternoon, everyone. Thank you so much, Dr. Kocher. Thank you, Sangeeta ji, for giving me this opportunity that I am speaking in front of all the champions who are really doing great job in their field. Atithi Deva Bhava. So it is India's mantra. So I feel we should give the best to our patients who are coming as a for medical tourism. And right now, this is the high time that we have to advertise ourselves in Europe and US also, because India is already very good choice for others, but we are getting less patients from US and Europe. So this is high time, because we are able to manage this COVID so well, and even we are providing vaccination to other countries also, as well as we are giving to our citizens. India is doing really great job in healthcare, and everybody knows, because Indian doctors are the best. Half of the US and Europe is run, medical facilities run by Indian doctors. They are, I don't know why, but they are really skilled by the grace of God. Their hands have some magical power, so everybody is getting benefit from them. So when we talk about medical tourism, I want that, like we say, end-to-end encrypted, I want to say end-to-end accredited. So medical facilitator to the hospital who is providing facility to the person who is coming as a patient. We need to have some help desk at airport. So person who has come, patient who is not very much, aware about this country, hospital, somebody who is not enrolled anywhere and he is coming for treatment. There should be some help desk. Like I am representing Service Export Promotion Council also. So I would like to take this initiative that there should be someone, some facility for them, that when they are reaching to India, at least we should know where they are going, which kind of treatment they are getting, which kind of facility they are visiting. So that is why I want all facilitators who are providing medical tourism to the patients, they should be accredited. There should be some track record when person is landing to India, where he has gone for treatment. So for this, I think if we can mandate it, that accreditation is mandatory for everyone who is providing medical facility to foreign patients. Same time, I would like that hospital should, send an invitation letter to the patient, so he can come and he has to reach to the same hospital where he has, connected with through somebody. In SCPC portal, we are providing details, but NABH can play a major role. And as we are talking about Atmanirbhar Bharat, we should focus more on NABH rather than JCI or other accreditation body, because NABH is better than any other accreditation body. As I got this opportunity, I visited US best hospitals, as well as I visited NHS hospitals, some private hospital in Europe. I get this opportunity, but I find that Indian healthcare system is the best. So when we are the best, why we are not able to provide best facility with good outcome? Because when we are providing good outcome, it should be at least registered somewhere. So there should be some system where all hospital has to, send some their outcomes of the patient and other patients who are coming. There should be some portal, I think. Then we need to regularize so many things. Like as a policy, it should be there that how many patients you treated, what are their outcomes, so other person can see and hospital can get some rating. Accordingly, patient can choose a hospital for their facility according to their needs. Like if they want to go for some transplant, they have to choose their hospital according to what is the highest rate of some, success rate of the transplant. So we need to, create a system where all the good hospitals, all the good facilitators, because I want who is coming to India for treatment, he should not get cheated here. He should get best facility. And for this, NABH can play a major role, because there was a program, still it is going on, but unfortunately it could not get that much popularized as it should have. So all the facilitators who are providing this facility to foreign patients, they are supposed to enroll themselves with NABH. Only then they can get this facility, that they can, contact somebody. So Ministry of Commerce has to play a major role, that they need to make new guidelines for MVT, because India is not only providing modern therapies. We are providing Ayush, we are providing Unani, homeopathic, lots of things. And people are not only coming for modern health system, they are coming for Ayush things, some are coming for yoga, some are coming for different kind of, because our system is very, very old and our system is really good, and other countries are adopting our system. But when we are providing this Ayurveda or something, so we need to give our best. As some guest is coming to our home, we try to show off all the best of our home in front of them. Same kind of thing we are supposed to provide to our patient also. They should get a very good feedback. They should feel really relaxed and comfortable feeling in India. And not only treatment, we can give them some different kind of feeling. They should feel like they are at home. So this is my point of view, that when you are doing medical tourism, kindly we should provide more sensitive care to our patients, so they have to feel this thing, that India is the best place as we are the best. And I believe that Indian doctors are the best. Thank you so much.
Thank you, ma'am. Thank you so much. Really very important points you've brought out. First, of course, the Indian healthcare services essence of providing healthy healthcare, and of course treating every patient with quality. And definitely technology will play a very important role, as you've said, that somewhere downline the portal has to be there wherein they could register, the hospitals could register the success rate, the success stories, and that actually brings in a lot of element of that transparency and trust which Commander Navneet Bali brought in. So I think very important points. And of course, artificial intelligence and AI and ML plus your technology, they all would play a great interface in terms of putting India at truly the global healthcare map where it deserves to be. So with this, may I now invite Mr. Arvind Vachasvi, who is the Managing Director at Sri Sri Tattva, a very distinguished industrialist and a passionate entrepreneur. He, of course, is responsible for basically putting the healthy, happy modern world through ancient science of life and well-being, Ayurveda. So over to you, Mr. Vachasvi. We're looking forward to hearing from you as to what is your thought process and how do you amalgamate the Ayush healthcare services and the modern science and offer it as a package to the global healthcare seekers. So over to you.
Thank you so much, Praveenji, for that really elaborate, introduction. And now there's a lot of pressure to live up to that. But having said that, Madam Sangeeta Saxena, Director, Department of Commerce, Dr. Manoj Nesri, Advisor, Ministry of Ayush, Dr. Atul M. Kochar, CEO, NABH, Shri Parveen K. Mittalji, Senior Director, FICCI, Professor Bijon Mishra, Srimati Upasana Arora ji, Shri Dilip Kumar Chopra, Dr. Vikram Chatwal, Shri Manoj Garg, Dr. B.K. Rana, and Navneet Bali ji. It's a pleasure to be here with all of you. And having listened to all these wonderful points that what my previous speakers mentioned, and also the wonderful context that what Srimati Sangeeta Saxena and also Manoj Nesri ji put across, I feel that there's a lot of scope for how India can become as a center of excellence and also B as a place where that is the definition of quality healthcare that what the world can look forward to. We've seen, especially during the pandemic time, that India has been the leader and also, proving to be the world's pharma hub, to see that how even vaccines could be sent all across the world. We've seen that even during this lockdown time, how much education and awareness about the Ayush systems were also made to India and also across the world through the Ministry of Ayush. One particular thing that what I would like to mention here is that the Ayush systems also got the level of being as the essential goods and services under the Essential Commodities Act. They've been added in during the pandemic time, which is really fantastic. It really shows that how the government is very serious about the systems that what have been developed here in the country. I'd like to come across to certain points, Pravinji, as what you rightly mentioned, that despite so many recent challenges of the COVID-19 pandemic, and also a little bit still that's already present also right now in India, what we've really noticed is that the Ayush treatment systems, can be given a unique push and are extremely relevant even today. And what does this really require? A whole lot of this has been done, but let me just tabulate it for everybody here to also make a note of. One is that certifications of treatment centers about their authenticity. We need to ensure that all these treatment facilities that are there online, they have a certain certification that would be well known not only in our country but also in their country as well. And I think that our Indian missions would definitely play an important role for this education. Second is that we also need to understand that we bring in quality trained personnel into this particular field. A lot of steps have been taken across over the last couple of years, and this is something that what we need to continue to do. Next is that following the SOPs across all units, so whether it's manufacturing, whether it's being with regards to schools as to how the therapists are trained, and of course, even ensuring that the SOPs of the treatment centers are also followed to the T. That's very important. One more thing, the next point that what I would like to make a mention is that we need to keep portals of the government informed as to how these things could happen. So I would request that, that the Commerce Ministry and the Ayush Ministry take note of this to ensure that how this education and also the new activities that whether it's industry or the services sector are doing, be put across and people are educated on that. And next, of course, I feel what is very rightly needed at this particular hour is that more awareness should be created to implement the NABH certification to Ayush hospitals. So, and once these things are done, it's also important that NABH and also the government see that how these hospitals are championed, not only in India, but also across the world. Very, very important. Of course, we need to understand that this sector can improve health tourism, but also generate revenue and employment, whether it's here in the country or whether it's in the countries that where we are targeting health tourism. We could have satellite centers, have doctors positioned there for at least diagnosing, and in case if there has to be any sort of more serious intervention, then later they could be referred back to the Ayush hospitals here in India. Apart from that, we need to understand that India could be made as a treatment hub when it comes to the Ayush systems, because we provide an important edge over other countries in Asia, while all the other countries might prove and also bring across more on the spa therapy and also on a way to indulge oneself. But we understand that, through treatment and therapies here in the Ayush systems, it's more medical intervention. And that's something that what we really need to push and see that how we could make India have a upper hand on this. Of course, healthcare providers should take care from arrival until accommodation and also treatments. So this is something that what I feel that in case if there is some sort of financial assistance also from the government to see that in case if they do have certain certifications, then later they would be eligible for these financial assistance from the government. We need to also understand that according to experts, recent studies show that the Indian medical tourism market was expected to double and also reach the $8 billion mark by 2020. But due to the pandemic, these things have slowed down. But I feel that, if proper steps can be taken, we can still achieve this. Currently, Bangladesh and Afghanistan, dominate the Indian medical value travel with almost about a 34% share. I'm sure that with a whole lot of integration of surplus talent, technology, like what my previous speakers mentioned, tourism attraction, trade and tradition, India is having the potential to promote itself as a premier global healthcare destination and also enable streamlined medical services. So I think these were, some of the points that what I wanted to put across. The Ayush systems have a great, value that what I feel that we've really recognized during the pandemic time. And I feel that with a little bit more of SOPs being put across onto these systems and making everything perhaps into a single window clearance, both when it comes for the customer side, but also very important that for industry to have access to these certifications, we also need to see that that also happens to have a single window clearance. So one is a single window for the back end and another single window for the front end as well. So I think with these points, Pravinji, I leave it over to you, and thank you very much for having me here again, Sangeeta-ji, Pravinji, Dr. Atul, and also Dr. Manoj Mistry. Thank you very much.
Thank you, Mr. Vachasvi. I mean, you are the face of rational, holistic care of India, and these are wonderful words of wisdom, actually, when you say that a hub-and-spoke model based on rationality, based on proper, adequate certification should bring in lots of structure and sense to this largely unregulated market. And I truly endorse and concur that there has to be, for personnel also who are practicing abroad and promoting Ayush there should be a certain sort of standardization as far as their credential and privileging is concerned. And it will go a long way in bringing lots of reputation and further business for the industry also. Moving on to our next speaker, Dr. Vikram Chatwal. Are you there?
Very much here.
Vikramji?
I'm here.
Hello.
Atul, I'm here. I think we've lost Atul.
So, Dr. Chatwal, I'll step in here for my colleague, Dr. Atul Kochar. So this is, as you know, an important platform and a topic for discussion today, wherein we are trying to assess and see, what quality and healthcare services, offer as an offering to the world as medical value travel we bundle up. So I would now like to hear from you and, in fact, all our audience here. What are your thoughts and what are the areas of improvement and what are those recommendations that you want to suggest to the panel here? And those recommendations definitely will go a long way in terms of putting the Indian healthcare services exports globally on the map. So over to you, Dr. Chatwal. Dr. Chatwal,
thank you very much. Yeah, thank you very much. Appreciated, Praveen, and a very good evening to all the panelists with me and, of course, the listeners. And I think an area that I wanted to cover in today's discussions was what would it take to build an ecosystem for insurance-backed medical value travel. And I think it's increasingly becoming a topic that's relevant to not only domestic healthcare, but global healthcare. While medical tourism and insurance have never been there in the history, insurance has begun to creep into the tourism industry. Medical tourism is no longer the choice of the underinsured or the uninsured, but also the insured. And I think given the current pandemic, it plays out. If I look back into the SARS epidemic and look at Hong Kong's data in 2005, or between 2005 and 2008, the outbreak was in 2005, and I looked at data between 2005 and 2008, and would find that for the next 3 years, between 2005 and 2008, the premiums of insurance that were charged to the people of Hong Kong had grown between 13 and 20%, if I remember right. And so the cost of medical care actually went up post an epidemic in Hong Kong. And now if we kind of bring that back to our world and look at what it would cost to get medical care globally, given the pandemic, I think it would be an expensive proposition, and thus the conversation around medical value travel, and thus the conversation around what's the role of insurance and global cover in the medical value travel business. Just very quickly, why do people travel for care or medical care? First, of course, is the quality of care, both for nearshore, and we've heard Bangladesh, Afghanistan. These are, I think, nearshore countries that travel into us, and of course the far shore, who come from the developing world, and we've looked at the Middle East, we've looked at the Africas, and of course people who come in from care. The driver for why people travel for medical care is the cost of care. And the cost of care has traditionally been the developed world, which is all about affordability and what's covered under an insurance plan and what's not covered under an insurance plan. So a lot of people traveled because it was not covered under a plan, and so affordability was an issue. The third area why people have traditionally traveled, increasingly in the last 2 decades, has been the employer-sponsored medical tourism, and employers who buy health insurance policies. And we've seen that with our own diaspora in the Middle East and in Southeast Asia, where the diaspora actually gets offered plans that allow them to get repatriated back to India for medical care. Where it's a global insurer, you get repatriated to India for medical care. And of course, like many speakers have spoken about, the credentials of the country, the social, the public infrastructure, the hospital and medical capabilities, ease of travel, language, etc. And I think, so there's a plethora of reasons why people travel. But when insurance comes into play, it kind of goes outside the realm of traditionally what medical tourism has defined. And traditionally, medical tourism started with elective procedures not covered by medical insurance. We talked about, and we've all read about spas, we've read about cosmetic surgery, we've read about gender reassignment surgeries. And so that's been one big basket of why people have traveled. It's not been covered by health insurance. The second is that there is poor infrastructure and poor medical talent in the country of residence of the traveler. While both these have actually played out, and we've seen Southeast Asia, parts of the Middle East, for various reasons, come alive with medical tourists, the segment that I think becomes even more relevant as we go forward in the pandemic and post the pandemic is when people start traveling for medical care that is truly for sickness. And so it focuses on not only secondary but tertiary and quaternary medical care, which is serious medical illnesses. And the availability of not only medical talent coinciding with technology becomes relevant. And we're beginning to see that already in our markets. You just heard some of the speakers talk about, people coming in with different types of cancers, people coming in for bone marrow therapy, people coming in for IVFs, and a whole host of other tertiary or quaternary care medical interventions. As we look back in 2019, in some of the readings, it talked about medical tourism resulting in an annual saving of about $20 billion of health-related expenses globally. And that's a substantial number. And this is the savings. So the actual cost would be a factor, a multiple of the $20 billion that would save. And I think this is the most significant factor that has led to the insurance industry waking up to offer products that specifically cater to medical tourists. And so as we go along and we think about how India will position itself in that market where people with illness and disease are looking to travel for medical care to India, let's talk about what are the challenges around health insurance portability. And I'm using a term that we use in India, which is health insurance portability. Insurance portability in the Indian context has always been been a reference to in the regulator. IRDA came in and talked about portability a couple of years ago, allowing the policyholder to make the choice of switching from one insurance carrier to another, and so that you could actually transfer the benefits and move from one carrier to the other, depending on your likes and dislikes and choice of carrier. So when you look at global portability, and you look at what its implications in the health insurance market that will feed medical tourism, I strongly believe that portability will propel the Indian medical tourism market. In an era today where we have mobility, an increased number of people who are moving across countries for various reasons, including the Indian diaspora, one of the big reasons for moving is also medical care, or being close to good centers of excellence, like India. And that is, I think, a big focus or a big impetus for insurers to build that form of portability for those who are insured. A problem that a lot of insurers have not totally and fully solved is the idea around follow-up care. This is post-procedures. Most often, you have to take the individual gets repatriated back to the country of origin and follow-up care. But I think as we heard speakers talk about technology, talk about telemedicine, there seems to be at least a solution in the making around what happens to follow-up care, alongside making the local healthcare system in the host country of where the individual came from responsible for care or post-surgical care. There are issues around data on confidentiality, like every other, and PHI, but I would leave that for subsequent deliberations. In summary, as I think about global portability in insurance, what do we need to do as a country to be able to participate in that market where people have bought some form of cover, and there is a potential of adding on portability to that cover? The first is to think about what is a framework for the Global Insurance Alliance, or a framework around building a global insurer base who looks as India as a destination and adds that to their list of portable regions that you could actually port your policies to. It not only looks at global insurers, but we also need to look at our domestic insurers who will offer products to global customers who would like to buy portability, allowing them to repatriate for the Indian diaspora, but for others to come into India for medical care. And I think there's work to be done there. The second is, when insurers work with any market, they look for Indian carriers who manage the claims, access to a network of hospitals, pricing and settlements, including credit terms. And I think again here, the insurance regulator in India has been at the forefront of thinking. There is now at least, there is already a third-party administrator framework, or what we call a TPA framework in India for claims within the country. There's an equal opportunity for aligning what we do in India with global insurers, so that as they think about not only an individual traveling, they also think about the related documentation that needs to travel along with the individual. How do claims actually get managed and settled? What's the settlement cycle? Like any other NEFT that you and I do in the financial services market, we need to think about what's the NEFT equivalent for claims in India. And I think there is already a robust market of third-party administrators regulated by the IRDA who do that work in the Indian context in a very limited way for global players. They do that for inbound traffic. And so I think there is already a framework for inbound traffic, but that's a very limited or a small sliver of the whole opportunity going forward. The second area that everybody's talked about, and Atul, is close to your heart, is the whole medical value travel facilitators. And how do they actually interplay with insurers and at the same time with intermediaries like third-party administrators? And what's the interplay between them who facilitate a journey, facilitate an experience alongside a claim and an insurance cover? With that, I'd hang back to you. Thank you for giving me the opportunity of speaking with all of you. And I hope this has been helpful in the overall context of, for medical tourism. Thanks very much.
Thank you, Dr. Chatwal. I think very important points that you have brought out here, largely for the Global Insurance Alliance and also the insurance portability as a global phenomena, and how India could really leverage in the entire value chain, and how India can actually benefit out of this. So I think this is something as a very, very important recommendations that we take from your thoughts as of now. But of course, going forward, we have a lot of questions for you also. So we are getting some questions. With this, may I now invite Mr. Garg, Manoj Garg, who's the CHRO and Business Head International for Dr. Lal Path Labs. He's been driving the organization's efforts, not just about in India, but globally as well. He's been instrumental in expansion in countries like Nepal, Bangladesh, and Kenya. It would be very interesting to hear and understand from you the entire dynamics of business, not just about in India, but even abroad, and how are you, providing services there? And we've seen in recent times, testing is the key to, healthcare. So we would sincerely look forward to hearing your thoughts on medical value travel, and how do we integrate, your services with the medical value travel sector, and how do we benefit out of it? So over to you, Mr. Garg.
Thank you, Mr. Mittal. Good evening, everyone. Thank you, Madam Sangeeta, Dr. Manoj, and all other participants and speakers. I'm really honored to be part of this session. So, as Mr. Mittal just mentioned, Dr. Lal Path Labs is a very well-known entity in India, but not many people know that we also operate or do business with 23 other countries. So we are today having clients on the western side of the world, as far as up to Ghana, and on the eastern side we get samples from Malaysia, and recently from Papua New Guinea as well. We have a client now. We have 3 labs, one in Nepal, one in Bangladesh, and one in Kenya, which is serving the local markets. However, for today's discussion, which is medical value travel, I think I'm going to focus predominantly around all the samples which we bring to India. Now, these are high-end samples. Doctors are referring these particular cases to be tested, and most of the countries we are picking samples from, they don't have the testing facilities for these tests. So in our scenario, instead of patient traveling to India, it's basically just the sample which is traveling to India. So there is a huge cost advantage for the patients or the institutions which are, let's say, giving these samples to us, because if they are not giving it to us, they are probably getting these things tested from Europe. So Africa is either connected to South Africa or to Europe, sometimes a little bit of North Africa and Egypt. And similarly, a lot of Middle East, let's say, countries, institutions, they're also sent to Europe. So definitely there is a great advantage which all these institutions derive. They're able to really get a world-class quality testing at a fraction of the cost compared to Europe. And obviously there is an element of convenience, because the patient doesn't have to really travel, or the diagnosis can be actually a good diagnosis before he or she is traveling for a specific intervention. The interesting part here, which I wanted to share with the group, is that when you talk of medical value travel, there is a very clear concept of a medical visa. So the patient is able to apply for a visa and can come. Once the visa is granted, the whole process is, let's say, initiated. However, when we look at samples, we face a lot of challenges with respect to government, each country's government trying to regulate this area of outsourcing of samples. In fact, sometimes we feel that governments are kind of caught into a catch-22. They don't have the medical facilities for testing these particular cases, and thus they have to depend on exporting these samples. However, their desire is to create those facilities, and thus they are putting a lot of restrictions around it. And we all know that it takes a lot to build the whole medical ecosystem. It's just not a laboratory which needs to be put in. You need to have a reagent ecosystem. You need to have OPD doctors. You need to have technicians. You need to have specialists. So it's going to take a lot of time for these countries to build this particular capability. Till such time, it would be great if we can have a mechanism by which there is a bilateral agreement between these countries which require these services and us as players who have these services, so that we are not on a daily basis constrained by regulation. Just to take an example, very recently, I think Dubai Health Authority has come out with a regulation saying nothing can be exported or you can't send samples outside. We have faced similar challenges in Bangladesh and many other countries. So while medical value travel is very well established in these countries and patients are flowing into India, I think a similar ease, if it is available for samples to travel, then it will be a great help. So, Madam Sangeeta, you are looking after Department of Commerce. I am requesting you to just look into this aspect of how this particular element of allowing on a bilateral basis a kind of ease of sample travel is taken care of. And there is an associated issue with this, because countries which are restricting samples to go out of their country also thereafter restrict the forex or the payments for such outsourcing to go out. So it's a double whammy. It's very difficult to build a business where the government is not facilitating, government of that particular country is not facilitating, whereas the clinicians really need this help. Now, I would talk a little bit about the productivity and quality aspects. In our business, there is quality which is ascertained by having great accreditations. So our labs in India, they have the highest level of accreditation. So we have NABL accredited labs, we have CAP accreditations, as well as ISO. However, in lab technology area, a quality of result is a lot dependent upon the quality of sample, which in turn gets impacted by the time, transshipment time. So when we are really bringing samples from various countries, let's say Ghana, what we experience today is that there is no clear mechanism by which we can bring biological samples in the fastest time. Sometimes we use courier modes like FedEx, DHL, Aramex. We have direct cargo capabilities from certain countries like Ethiopia. However, there is a lot which can be done in creating direct cargo connectivities between the countries or between the locations where direct flights are existing. Today, quite a lot of airports are lacking the ability to manage direct biological samples at the cargo level. And a very interesting case in point is from Dhaka, we are unable to transship samples directly to Kolkata. And as a result, the modes which we choose brings the sample in somewhere between 24 hours to 36 hours, whereas the flying time between Dhaka and Kolkata is less than 1 hour. So there are some of these constraints which lead to poor quality of samples or deteriorated quality of samples, and as a result, we are unable to provide best quality service. Now, that is also a great productivity booster, because if we have a possibility to connect a sample between two countries overnight, and we are able to provide reports the very next day, then we have found that more and more clinicians are able to recommend even routine tests and utilize this mode. So if there is one suggestion which I have on the transportation side, is to see if we can create a kind of a let's say express corridor for biological samples and sample handling capabilities through direct cargo mode at various let's say airports. That would be a great help. On the on the part of collaboration with the MVT industry, what I just wanted to share with you all was that we did explore some with some let's say players who are facilitating the patients' flow to India, and what we realized that and it was very interesting to hear from them that sometimes the countries from where patients are coming, they need a high quality pre-diagnostics in terms of pathology testing before a line of treatment could be confirmed. However, in absence of such facilities, the patient arrives in India, and once the diagnostics happen, the course of action changes. So it definitely leads to inconvenience to the patient. It leads to increased residence time in India, as well as probably escalated costs. So there is definitely an opportunity wherein if we play in a collaborative mode, we play on the strengths of our capabilities to connect samples from any of these countries and provide that pre-diagnostics phase for all the MVT players. And thereafter, once the clinician is able to take a decision as to what's the right course of intervention, then the patient can travel. I think it will improve the patient outcomes. It will improve the let's say satisfaction, as well as it will reduce the cost without compromising on the overall quality of care. So these are the few thoughts which I had, which I wanted to share with the group. I know our services are not exactly classified or classifiable into MVT, but whatever little which gets overlapped, these are few elements which are of. Thank you very much. Over to you, Mr. Praveen.
Yeah, Mr. Manoj, thank you, sir, for this wonderful perspective. I think it's a lateral, out-of-the-box perspective which you've given us, and this can go a really long way if streamlined and the collaborative approach can be taken as an extended triage of all the patients combined with the telemedicine portal to bring in a more structured approach, and is definitely a welcome step in case implemented for all the patients arriving in the pre-tested mode with so much time saving and turnaround time and increasing the efficiency also. I think all the other approach about the airport collaboration, the other things are also well taken, and we will definitely be compiling and requesting you for your finer recommendations on the subject. Moving on to Mr. Dilip Kumar Chopra, who represents Foundation of Healthcare and Wellness Promotion. He's Director of Empathy Solutions, with a healthcare professional with more than 30 years of experience in the health and wellness space. But prior to that, sir, let me submit that NABH, as you are already aware, is currently running about 21 programs under the broad headings of certification, accreditation, and empanelment. Right, and we are currently partnering with more than 11,000 hospitals across India in various capacities. One program which was launched about 4 years back, that was the Medical Value Travel Facilitator, and you are an accredited empaneled agency for that. So that somehow could not become popular, as Upasana Madam also mentioned. So while you are giving us your recommendation on quality and productivity on the industry, please also mention the ways to improve the enrollment and whether government should step in and make this very, very crucial certification program mandatory program. I mean, should regulation supersede or should we keep it voluntary? Over to you, Mr. Chopra. Please unmute, sir. Please unmute.
Is it audible now?
Yes, please.
Yeah. Thank you very much, organizers, for giving me an opportunity to give my inputs in the field of medical value travel. Basically, when a patient travels to India, he spends his 95 to 99% of its time with 3 service providers. One is the hospitals, second is the medical value travel companies, or what we call as even the language interpreters, and third is the accommodation service providers, that is the budget guest houses, 3-star or 4-star or 5-star hotels. Now coming to, I am interested that these all 3 categories should be certified. The first category, that is the hospitals, they are NABH certified. There is no problem. We have achieved the 5th position as the most preferred destination for medical value travel because of our quality doctors, because of our quality hospitals. Now, if we want to retain this position even at the 5th position, or if we want to go up to the ladder, we need to sharpen our skills, or we need to excel in the field of certification of the other 2 categories, that is the medical value travel companies, or you can say the language interpreters, and the accommodation service providers. First of all, I'll come to medical value travel companies. Sir, as rightly said, 4 years back, we have brought in FICCI in, you can say, in consultation with NABH. A program has been designed especially for medical value travel companies to certify them. Sir, thank you very much for bringing in that, but that program is meant only for the large sized, or you can say big sized medical value travel companies. And there is no incentivization for the companies to undergo NABH. I'll just first categorize the medical travel companies into 4 categories. The first category is the large and big size companies which are having more than 15 employees. And these are, I think, the 20 odd companies which have accredited by NABH, they fall into that category. Then we have the medium size companies which are having employee strength from 5 to 15. And then the third category is the small size companies which are between 2 to 5 employees. And last category is the individual medical facilitators, or what we call as even the language interpreters. I don't say that it is essential for the big companies to undergo NABH. No, it is very, very essential that all 4 categories we should get the certifications, because the patients are being facilitated to India by all 4 categories. So if we want to go up to the ladder, if we want to achieve a higher position in the world, or if we want to retain it even at the 5th position also, sir, because the competition is immense, we need to have certification for these all 4 categories. And sir, we need to formulate a NABH program, certification program, which is suitable for all 4 categories. So that is what my submission is. And it is very, very essential if we want to go up to the ladder, or even if we want to maintain the position of 5th in the world. Now coming to the other thing which we have not at all considered till date is the certification of accommodation service providers. Sir, usually the decision of taking a treatment in a country or in a hospital, or it lies with the attendants. And if attendants are not satisfied, then you can see that they'll come once, the repeat sale will not be there. So it is very, very essential that along with the patients, we need to satisfy the attendants as well. So if they do not get the proper accommodation, or even if pre and post, if a patient also has to stay in a hotel or in a budget guest house, if that is not meant for a patient, because usually the hotels and the guest houses are meant, the rooms and the toilets are meant for the normal tourists. They are not at all targeted at, if a patient is coming, then there should be support mechanism in the toilet as well also. But that is not there. We need to certify the accommodation service providers as well if we want to go up to the ladder. Sir, now coming back to why the companies, the medical value travel companies are not voluntarily
Mr. Chopra, we can't hear you.
Mr. Chopra?
Mr. Chopra, we can't hear you. If you can hear us. I think we'll have to go back to him. No, you're not audible. No. No, Mr. Chopra, we can't hear you.
I think you'll have to log out and maybe log in.
Log in again, yes. So meanwhile, we all await for Mr. Chopra to re-log in again with us because of some audio disturbance. Very important point which has been able to bring out, and that is largely that what is in for a certified NABH medical value travel facilitator. What is the incentive? What does he derive? And in case if there's no incentive, then of course NABH stands for quality. So while we all understand that brings in the quality perspective for any value travel facilitator, but as accredited medical travel facilitators, definitely we need to look at incentivizing them or some kind of a push and pull factor which motivates others to join the bandwagon. And of course, after having 4 years run successfully, we need to look at numbers which could actually bring in the desired numbers to increase the medical accredited value travel facilitator. So with this, I want to invite now somebody who's known for quality. Dr. B.K. Rana is the CEO of Quality Accreditation Institute. He's an international consultant and expert for WHO, World Bank, Asian Development Bank, USAID, and several other national and international organizations. His expertise includes establishing healthcare laboratory accreditation bodies, implementation of quality management systems, and standard development in field of quality and patient safety. So, Dr. Rana, we would like to understand from you that how can we integrate quality with medical value travel, and let that become the championing factor for patients traveling to India for treatment. So over to you, Dr. Rana.
Thank you very much, Praveen for the nice introduction. And thank you very much, Sangeeta Madam, Department of Commerce, Dr. Manoj Nesri sir from Ayush, and all colleagues on the panel. It's really wonderful to hear all the experts and be in the line at the last so that you know what is not covered and you can cover up. And it's also avoid duplication as well. So thank you very much for this real and great opportunity. The question related to quality, and many of my colleagues on the panel have spoke about it in different dimensions, ranging from diagnostics to healthcare facilities and facilitators and homestays and even hotel stays and so on. So in my opinion, strongly I believe that there is a need for creating a system of building trust to ensure quality, safety and logistics as we are talking about medical value travel. And this can be, I think, achieved as we have an example of in India, NABH accreditation for bringing quality in healthcare facilities. So this can also be done through a model of accreditation or medical travel programs. It's not about standalone hospitals, it's not about standalone medical travel facilitators, it's not about the accommodation part, but it's about the whole program which encompasses all these components that Chopra Saab mentioned very clearly. We have best of the hospitals and doctors. Many of us talked about it. We have accreditation for last several years in India. And I think, Pravinji, thank you for introduction. I just want to add that I have been the director of NABH, and I think I'm one of the first staff in 2006. And I've seen how the healthcare quality has gone up in last several years through the mechanism of accreditation. So we have the clinical quality already established. Medical value travel is happening, and I think everyone is saying we are in the 5th place. And it's moving up. But the major question comes, is this enough? And I think answer is obvious no. And that's why we are here and discussing about this issue. So if you look at medical value travel as a whole, as an ecosystem, there are few ecosystems within that. First is the patient's perspective. What is patient's feeling about it? What the patient experience about, starting from their own home, traveling from their own home to a destination country like India, as we are talking about, and then get the procedure done, maybe a post-procedure stay required after hospital discharge, and then follow up, and then go back to his or her own country. And maybe again, the follow-up. So how the patient feel about this whole journey from start to finish. The second component is the provider's perspective, the healthcare facility, how they are motivated to participate in medical value travel programs. Many hospitals are already providing these services. There are facilitators who are bringing in patients for them. There are hospitals doing their marketing themselves. But is this enough for getting more and more what we are envisaging in time to come? And then third component is the buyer's perspective. And buyers may be the government of that specific country who is sending the patient out to India. It can be an insurance company who is paying for the treatment. Is this the right way, or we need to evolve a way to connect these buyers to our service providers, keeping all the interests of the patient in the core of this ecosystem? Now, if we look at the whole, again, I will repeatedly mention is the ecosystem of medical value travel. There are key elements for making it successful. We need a government support, and I think there's very evidence, and that's why we are discussing. The Department of Commerce, DPIIT, and all Ministry of Ayush and Health, everybody is talking about it. We need strong public-private partnership. We need tourism activities. We say medical value travel, and travel is there, then tourism is there. Earlier we call medical tourism, which is replaced by medical value travel, is about the tourism activity, how we linked these tourism activities, marketing and promotion, how we market it, how we promote it, and then accreditation, of course, to ensure clinical quality, and last not the least, but the healthcare providers, are they interested to be participating in this program? As many of my colleagues talked about medical value travel facilitator and program at NABH, and I'm happy to say that I have been fortunate to be part of that, leading this program, panel program in 2016 at NABH. Pravinji, you remember very well, you from FICCI, you were there, and Department of Commerce, Sudhanshu Pandyaji was driving it. And we very well discussed about bringing in some program for even, the guest houses who are catering to the medical value travelers. in those cases. But that program has not picked up too much for various obvious reasons. And I think this is the time we are discussing and we may be thrashing out to overcome those challenges. So in those perspective, we at QI and myself personally, I look at what are the models available internationally which are working in different countries to enhance their medical value travel. So we got into an arrangement with the Global Healthcare Accreditation, GHN USA, to offer a joint accreditation program based on internationally approved from ISCOI standards, and building on clinical quality through accreditation. And we say the hospital need to be accredited by NABH in India, and then only they can qualify for medical travel accreditation program. So clinical quality rest assured through NABH accreditation, or even if they have any other international accreditation. And then we thought of how we move up to ensure that the patient journey starting from their home to hospitals, the care, the post of care, and then follow-up and return journey to his home is ensured in a manner that he has the trust and confidence in the hospital services, he has the trust and confidence in the travel services, he has the confidence and trust in the hospitality services. So all three components, and then of course for the payer is ensure the transparency in the payment mechanism, in the charging and all billing and all these things. So all this part of this medical value travel accreditation program. And then we have seen that how it is growing in other countries. Just an examples, the Bumrungrad Hospital, International Hospital in Thailand, one of the famous destinations for medical travelers, has also gone for this accreditation program. Cleveland Clinic in USA, Cedar Sinai in USA, some other in Middle East, they are traveling to that program through the program because they bring them the whole ecosystem, the trust building mechanism for them. So the quality specifically for covering the entire journey of the patient, linking with three components, once again, the travel, the stay, and the medical treatment. So that is to be encompassing, we need to develop a medical value travel program, which is based on international best practices and standards. And as I mentioned, QI has already ventured into it, and we have already launched this program. And and it's not, one agency is not sufficient. We need to see many other organizations coming up and building on this. We need a very strong public-private partnership to widen the approach and the reach, because implementation is very, very important. Like MBTF, an impanelment program could not take off very much because they may not find incentive, they may not have a value. And most importantly, that is these programs are linked with hospitals, they are linked with, or they are just mostly seen as bringing a patient, leave it to the hospital and the job ends there. That's all. And now patient is at the mercy of someone else. And after treatment, we don't know what happened to the patient. And that's why the DOC has come up to ask NABS to develop this program, because there were a lot of complaints about it. So I think in nutshell, there is a strong need of developing an accreditation program to ensure quality, safety, and all the, the confidence, trust into our medical travel, which are flowing into India, not just retaining to the 5th position, going up at Chopra Saab mentioned. And I think that is what we should be building in. Chopra is just a lighter moment. I would say very important component of the stay, because the discussion from DOC and NHS was that when patient is treated in the best of the hospitals in Delhi, or in Mumbai, best of the hospital, best clinical care received, procedure is excellently performed. But after post-care, he go to a guest house, which is totally like a slum area. He get good amount of bacteria or fungus or whatever infection he get, and then blame goes to the hospital. Blame go to the country now, because he's traveling to India for treatment. So I think that was very much important to ensure, and we discussed at that time, DOC and NABS discussed that how we can, we can't legislate it, but voluntary scheme for that. And I'm happy to say that at QI, we have developed accreditation standards for hotels and homestays. And that was one of the purpose kept in mind, to ensure that whosoever is coming for travel ensures the safe stay, whether it is a leisure or it is a medical travel. So I think if we want to ensure that the quality maintains, even after accredited hospital provide the services, to get that benefit as well, that, yes, you have done it. That end point is also very important to ensure that safety is also ensured at that point of time. So I think take home message is to build on a strong partnership build on a strong accreditation program encompassing all the components, not just isolated pieces of these things. And I think we have to work and collaborate with each other. Thank you very much for a great opportunity to talk to you, and thank you so much once again.
Thank you, Dr. Rana. I think what you mean is what Upasana Madam also mentioned, the end-to-end standardization. So under the umbrella of standardization, all aspects of travel, logistic, everything must be ensured, and we must get together in a collaborative approach, all of us, to think how better we can devise all these standards to take, because the country's reputation is at stake. So there's no doubt about it. With the medical value travel is not only about a patient, it's not only about a hospital or a particular standardization, but the entire country's image is at stake. If Mr. Chopra is still with us for his closing recommendations, Mr. Chopra, are you there?
I see him logged in. But
in any case, So Mr. Mittal, in case he joins in, we'll be happy to have him. But I think this has been a very enriching Manthan. One of the best, and post-COVID also, there's lots of focus and synergy in all healthcare institutions. The healthcare industry is then back to focus, and there's no doubt about it that if we are to drive and take quality to the last man in the line, every bit of effort helps, and that's the only way out. So, can we have some questions, Mr. Mittal?
Yeah, so,
Mr. Chopra has mentioned in the chat box. Mr. Chopra has mentioned in the chat box that he is available. Mr. Chopra, can you just switch on your camera, please, sir?
We can't hear you, actually.
I think it shows, his display shows the poor internet connectivity. So I think that's maybe the reason.
Yeah. So I think let's straight away move to the questions, and we can request him to send his further closing recommendations over to us which would be included as a part of the compendium. Also a request to all our panelists here is that in case if you can send, your recommendations again, if you want to go through them and send it over email to us, that would be really nice. But yes, certainly we do have some questions, and to Mr. Varchaswi, how can Ayush service providers, that is hospitals and wellness centers, be encouraged to undertake accreditation by NABH? So that is something which is a question which we have received in the chat box. So over to you.
Thank you so much, Pravinji, and thank you so much, audience, for this question. I'd like to tell you that, at Shri Tattva, our hospital that's here in Bangalore is already NABH accredited. We're having multiple hospitals also, across the country, and they would also be soon NABH accredited as well. I feel it's important that there needs to be an education drive and also encourage hospitals to ensure that they take on this particular certification. The aspect that what you mentioned is that how can Ayush hospitals be encouraged to take this on? Is that I feel that a little encouragement from the government side, also in terms of both financial and also resource planning, if this support could be given, and also ensure that the schemes that are there for NABH are more current, I feel it would make a huge difference. So I think that here organizations like FICCI, Invest India, all these organizations can also come in and also handhold and see that how hospitals can be educated and how important it is to ensure that good practices are followed. While we say that a lot of quality needs to be done when it comes to the medicines aspect, and we have a lot of focus on the GMP, I feel that on the services front, it's very important that we make NABH as a total norm for hospitals to follow in the near future. But I think to put this across, it all depends on how Dr. Kocher could also see that how hospitals are made relevant and also educated that, how they could do things. But from an aspect as to see how these could be availed, from the industry side, I would say that yes, you ensure that when you are wanting to open across a hospital, you have a name saying that it would be NABH certified minimum. So that should be your aim, to ensure that you bring a hospital that has quality clinical practices to people. And when it comes to the government side, I would request that the schemes be made more relevant to ensure that both financially and in terms of resource planning, industry and sectors can avail of the same. Thank you very much.
Can I give my one small suggestion?
Just one important input, just echoing the sentiment of Arvindji on this, to my colleague Dr. Kocher, is that in case if NABH can have a considerable momentum in terms of promotion of these schemes amongst the people, and also if there can be an icon at the Ministry of Ayush website that for quality accreditation, in case if you need to click. I think any Ayush industry, the most visited site for him is the Ministry of Ayush site. So in case if there is a dedicated section on the website which talks about quality accreditation, so I think that would bring in that momentum amongst the industry and the service providers to go and register, because half of them may not be even aware of it. So just a point of what Arvindji was trying to suggest. So over to you, Professor Mishra. So in fact, my next question was to you only, but anyways, please go ahead. Sir, may I request you to unmute yourself?
No, it happens automatically. I don't know why. But some back-end issue. Anyway, so you have given a very good suggestion, Praveen Bhai. You gave an excellent suggestion. I was just going to add to that any hospital which is Ayush hospital wants to get themselves and I want to get myself accredited. And from there, the hand holding will start in terms of, I can assure you that on behalf of NABH, we will start talking to you to make sure that you become NABH accredited. First, express yourself and tell us that you are interested, and then we'll take it over.
Yes, and please allow me to submit that NABH has been very fortunate to have the active, dynamic support of Ministry of Ayush. We have till date, this is the only accreditation body in the world to have an active Ayush program. We have nearly 200 hospitals and all institutes of national repute which are currently accredited. And last week we launched the entry-level Ayush program, and within hours of launching it, there were 43 applications. So there's lots of interest. This is a low-cost initiative. Hand-holding is a part of that. We are building lots of resources on our website. There's a beautiful guidebook which is already uploaded, and any hospital which is keen to take part, and we will ensure that we hold a regular program on implementations, sessions for training, and free webinars. And Dr. Katoch, advisor to Minister Ayush, he today only wrote a letter to all health secretaries highlighting the importance of certification of all wellness centers, and there are 12,500 of them under the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. So that's a very critical part of our certification standardization process in the Ayush domain. And we are very fortunate that Ministry is taking these very, very progressive and proactive steps. So this has been a very interesting discussion, and lots of interesting insights have come out of this today's Manthan. We have talked from the logistic level to the artificial intelligence, machine learning level, Commander Bali, and every from end-to-end certification to collaborative public-people partnership approach. Dr. Mishra sir, you have rightly highlighted that patient has to be the center of it all, actually, because the entire industry is revolving around the patient center. So ultimately, the patient's goodwill has to be there. And every speaker, distinguished speaker that you mentioned, that ultimately it's the industry's image which is at stake. And ultimately, we have to live up to our Honorable Prime Minister's vision of a Atmanirbhar, self-reliant Bharat. So I think all of us in our own ways, small ways, are actively trying to contribute to this beautiful vision of a self-reliant India. Mithalji, do we have any time for closing comments? Quick one-liners each. I think that will add lots of value to everything. Mr. Sir, Dr. Professor Bijon Misra sir, just one line of your comments, please. You have to unmute, sir. Unmute, please.
I thought Praveen was saying there was some question. I don't know. Is it there or?
It's no. The question is there, but I'll send it to you.
I think we are getting repeated messages in the chat bot to.
Okay.
We'll go for
take it.
Your comments, final comments.
Okay.
Final comments now.
Yeah. So my final comment is that we must have a strong, robust policy coming up in terms of encouraging, patients from overseas to come, and we must have an easy accessibility to credible information where patients can feel very comfortable, accessing that information. And we should be able to stand by it and deliver it. So we have to be very strong in terms of delivery, what we are promising. So that is my closing remark.
Fantastic. Commander Bali?
Transparency and technology will propel us to be one of the best medical value travel destinations in the world. Thank you.
Upasana, madam?
India is a great country and our image is very good. So we can make our image always like this when we have some patient complaint reversal method. So if he has any problem, we can solve it. Some insurance policy for those who are having some complication after their procedures. And there should be some government to government tie-ups for payments. So patient and hospital both should not bother about money. So we are great and we have to be always like this. Thank you.
Wonderful. Arvindji?
So thank you so much, Atulji. So my closing comments would be as follows. One is that we must ensure that all Ayush systems per se, that what India can champion, must get a more meaningful place in the FTAs that what India would sign across to other countries. Medical tourism must be a part of it. Number two is that I feel we need to open across a single window clearance sort of system, both for where industry and hospitals can come in and see that how their certifications and also what they need to communicate to the consumer is set up. The second thing is like what Bijonji also mentioned, that we need to have a single window or a single place whereby by the use of technology, like what Navneetji also mentioned here, to ensure that how customers could have access to information. So I think that with these two things in place, I'm sure that the third point, which is an aspiration point, is that we could make India as a center of excellence for medical tourism. Thank you very much.
Dr. Anna?
Thank you very much. And my one-liner, as you mentioned, collaborate. We are a great country. We have great resources, rich resources, no dearth of technical competence. We can really build on this if we collaborate to build a greater ecosystem. Thank you.
If we have wonderful, Dr. Anna, definitely looking forward to collaboration. Mr. Manoj Garg, Dr. Vikram, sir, are you there?
Right. Dr. Atul, my comment would be, let's look at medical value travel not after the patient has landed in India, but start the life cycle much earlier, and let's find ways of integrating in-country diagnostics so that we can improve the outcomes for the patient.
Wonderful. So this is excellent recommendations. Thank you so much for all the insights. If we have Sangeeta ma'am around.
Thank you, Dr. Kocher and Praveenji for moderating the session very well, and a very big thank you to all the panelists. I, from Department of Commerce's side, I'm very happy to receive so many recommendations, so many relevant recommendations, and we look forward to working with all of the industry and other agencies to carry these suggestions forward. So looking forward to your support. Thank you.
Thank you so much, ma'am, for all your sincere dedication, your involvement in guiding us to this wonderful series of webinars. We'll be compiling all these recommendations into a compendium and passing them on to you for policy action. We'll be reaching out to all the participants. Thank you once again to you, and please allow me to hand over to Praveenji for your formal vote of thanks.
Thank you, sir. Thank you so much, Dr. Kochar. It was a pleasure working with you, co-moderating this session with you, and thank you to all the panelists. Great suggestions received, my colleague Aparna, and of course, our colleague Prasoon Mishra from NABH. They've been working together, to put this together, this entire program. And of course, the recommendations have all been noted. We'll be submitting it to government in form of a compendium. And also in case if our panelists have missed out on anything, you can reach out to us and send your recommendations once again. We'll be very happy to include them as part of the compendium. To Sangeeta ma'am, we started this journey 2015 when we really started focusing on MVT, and it's great to see that we've been able to bring in the entire value chain together and work together for the progress of in the medical value travel sector. And thank you so much once again, and have a good evening. Thank you.
Thank you all.
Thank you very much. Namaskar.
Thank you.
Jai Hind.
Thank you. Namaste. Jai Hind.
Thank you.
Thank you, everyone.
Thank you.